Well, the IU Simon Cancer Center has been on the campus of IUPUI now for the past 25 years.
And it has served thousands of patients in that time. In this month's Connecting with Community, we take a look at how it's helping not only patients here with medical care, but also others around the world with the research that goes on every day. The guy on the right in this picture is a high school teacher and coach. The one on the left is a doctor hoping to learn how to cure his prostate cancer. Together, they're making progress.
You know, it's going pretty well, and I'm very confident that we're heading in the right direction.
57-year-old Ralph Hartnagel got his diagnosis late last year, and his cancer had already spread beyond his prostate. He wanted to do more than just get chemotherapy and hope for the best.
Hi there. I'm doing well. How are you doing?
So he sought out doctors like Roberto Pili, who spends half his time treating patients and the other half leading research at the IU Simon Cancer Center.
Being a teacher, I love the educational aspect of it, so I love that, IU has that foundation of education and research that's tied to IU Health. So that they can work together to try to solve the problems for me and for other people like me.
Much of the problem solving at the Simon Center is done here in the lab, where funding has grown from under $30 million a year in 1992 to over $70 million today. It's gone from a handful of researchers and doctors to over 200 professionals on the current staff.
There are hundreds of cancer research centers in the country, but relatively few who also treat patients. This is one of them, the kind of place where patients can get the benefit of the research going on here sooner.
Dr. Pili specializes in prostate cancer and is studying how a strict, healthy diet can help cure his patient.
The ancient physician in Greece, Hippocrates, used to write, "Let your food be your medicine, and let your medicine be your food." It's really anticipating the importance of nutrition.
Good. This will help me know where you're at when you're not with me,
yes,
right?
Well,
he applies what he's learning here to directly helping his patients, like Ralph, who has cut out red meat and dairy and is responding well to his chemotherapy treatment. He's not the only patient here feeling hopeful about his prognosis.
You know, when I'm in the infusion room, there are people that come in from Cincinnati and elsewhere to come to this hospital. And to this research center, so that they know it's a good place to be.
It's also a place running more than 600 active clinical trials today that could change the way doctors treat cancer in the future. And a quick side note here, Dr. Pili is also encouraging Ralph to have a glass of red wine every now and then with dinner. Ralph's not a drinker, but he says he's working on it. And if you want to find out more about the IU Simon Cancer Center at IU Health, look for the story under Connecting with Community at WTHR.com.